Good afternoon, everyone. Thank you for those of you that have made it here already. My name's Sarah Chadwick, and I'm AMR and Infection Prevention Programme Manager for West Yorkshire Integrated Care Board. And I'm genuinely really pleased to be joining you today at our first live event, keeping all fingers crossed, with colleagues in Uganda. And we're delighted to be sharing this journey with you. So, in West Yorkshire, we've committed to working in a way that's ethical, sustainable, and inclusive, and that means learning from others, whether they are close to home or across the world. And we're especially proud of our partnership with Uganda. We signed a MOU in 2024, which set out our shared ambition to support each other's health systems. And up to now, that work's focused on maternal, obstetric, and neonatal care. But it was through these early conversations with our medical director, Dr. James Thomas, when he asked our colleagues at the Ministry of Health whether AMR, antimicrobial resistance, could be something that we could learn about together as well. And I can see that Solomon who's with us today, is on that photo. Solomon, I don't know if you want to take the opportunity just to introduce yourself.
Thank you very much, Sarah, indeed, for a brief introduction. My name is Dr. Solomon Kamradi. I work as the country lead for the Uganda Health Alliance, which is an existing partnership between the Ministry of Health and the UK NHS. And part of our work in Uganda is to provide coordination support to UK partnerships between to other partnerships between UK institutions and Ugandan institutions. And West Yorkshire is one of our flagship partnerships that has been working on a number of areas. And I'm sure, Sarah, you've highlighted a number of those. And we're pleased to be here and looking at how we can further collaborate on the area of antimicrobial stewardship. As you hear, it's a big burden for us on this side of the world. And I'm sure for many facilities, we are looking at how we can take up some of the best practices across the different institutions and hospitals in the UK and bring them home to improve treatment outcomes, but also antimicrobial stewardship. Over to you, Sarah. I hope that gives a brief background about myself and the Uganda Health Alliance.
Thanks, Solomon. It is, thank you. Today is, as Solomon said, it's very much that first step and just a chance to meet and share what we're doing and just start exploring where a joint approach might help. We're starting a virtual knowledge exchange, excuse me, but we hope that through this initial induction we can learn more about the successes and then needs of working on this complex agenda together for us all. So, and after all of our speakers, there'll be plenty of time for questions and discussion about our next steps at the end. I'm going to just start really quickly with a quick sense of who we are. So, West Yorkshire is one of the largest integrated care boards in England. We cover 5 areas that you can see there, with around 2.4 million people living across really very busy cities, but also quite rural areas as well. We're a very diverse population with a lot of strengths with that, but with that also comes some fairly big health inequalities that we are trying to reduce. And so to help us do that, we have 10 big ambitions that you can see there on the screen. And AMR is one of them. We know that infections AMR makes infections harder or even, impossible sometimes to treat. And that has a huge impact on people's health, on our communities, and even our other ambitions, and our environmental and our economic goals as well. So it's something we really take very seriously. As part of our wider work, we're of course been preparing for World AMR Awareness Week, and the theme this year is Act Now, Protect Our Present, Secure Our Future, which really highlights that need for joined up action on AMR and feels, I think, very fitting for the conversation we're having today. Here in West Yorkshire, our campaign, we try to make it relevant to our local population and our needs. And so our campaign focuses on helping people understand when antibiotics are genuinely needed, how to use them safely, and how to dispose of any leftovers properly, which means often returning them to a pharmacy rather than keeping them for later or sharing them, or indeed putting them in the bin. And I know Martin will talk to you a bit more about that later. And we're also encouraging good self-care for common infections and highlighting alternatives to antibiotics when they're appropriate. We've put together a digital pack of messages to support this, and we've tailored those for different groups, including students, sexual health services, social care providers, and our dental and oral health colleagues. So these are all really important settings when we think about preventing infection and protecting people who might be more vulnerable. So that brings me really nicely to our first speaker. So I'm really pleased to hand over to Mandy Goff, who's going to talk about her work on oral health and AMR training for adult social care staff, and how she's using this as a way to raise AMR awareness and provide support really for a community who need it most. So over to you, Mandy.
Thank you, Sarah. Good afternoon, everybody, and thank you for inviting me to talk to you today about a project that I've been working on for about a year now. As Sarah said, my name is Mandy Goff, and I'm an infection prevention and control practitioner working for the combined Kirklees and Wakefield local authority IPC team. And we've been working for the last sort of 10 to 12 months on a project around oral health and antimicrobial resistance training for our adult social care staff. So why did we look at this area in particular? So research shows us that poor oral health has been linked to lots of illnesses and infections, and particularly strongly to community-acquired pneumonia. And we know that good mouth care contributes to good oral health. So obviously, if we can improve people's oral health, that will reduce the risk of developing infections. And we found that although it's a really basic part of personal care, oral care is frequently neglected and requires improvement. Next slide, please, Sarah. So what do we do as a team already? So we provide annual infection control training to adult social care providers, and we as a team also do annual IPC audits of residential services. And during those audits, we look at service user equipment, and part of that equipment that we look at is oral health equipment. And we have found time and time again that this equipment is in a very, very poor condition. And so we know that there was an existing need for training in oral health provision. So how can we support improvement? Next slide, please, Sarah. So we wanted to develop a project with specific aims, and the specific aims were to optimise the oral health of our service users and improve general health and well-being. And it looked like, at the time, a fantastic opportunity to raise awareness of antimicrobial resistance. And I'll come on to the relevance of why that was so important later on. Next slide, please, Sarah. So we wanted to use evidence-based government-led guidance and tools to create a toolkit, really, by way of education to sort of show and raise awareness of the established links that exist between poor oral health, community-acquired pneumonia, and antimicrobial resistance. So we developed the education and training package to deliver really to people who were providing mouth care to service users, but that has actually mushroomed a little bit. So next slide, please, Sarah. So we've actually ended up delivering to nursing and residential care home staff, home care support staff, hospice staff, and council employed adult social care staff across Wakefield and Kirklees. And we also wanted an opportunity and a means to cascade this information further down the line to friends and family of service users. And to do that, we created packs to give out where care homes, for example, could create boards or booklets that friends and family were welcome to look through. Next slide, please, Sarah. So we've used a multitude of resources. In our main face-to-face training events, we've largely used a classroom-based style of presentation, but also included some practical sessions looking at resources like oral health assessment tools and images of mouths which clearly show oral health problems, hopefully to give staff that confidence to be able to identify and correctly document and escalate any problems that they come across. We've used a lot of Oral Health Foundation resources, which are readily available online. Some of them are chargeable and a lot of them are free to use. We've also done sort of Q&A sessions using Bingo as a tool, and that's been a really good session for those that attended. And we've also done quizzes and other things to support. Next slide, please, Sarah. So there were quite a few learning outcomes based around the sort of understanding oral health and how to improve it for service users and the links to systemic illness and infection. But clearly there was a key learning outcome, which was that participants should understand the concept of antibiotic guardianship and have an awareness of antimicrobial resistance. Next slide, please, Sarah. So we're just over 3/4 of the way through this first year's programme, if you like, and we've evaluated as we've gone through. And currently, I think it's looking quite good in terms of how we can move this forward. There's been a lot of learning for us as trainers around where perhaps we need to focus more attention. But as you can see from the slide there, 90% of participants felt that their motivation to provide better oral health care had improved, which is fantastic. Everyone agreed that the training was relevant to their roles, again, which shows we're on the right track. Oral health had improved by 100% and AMR by 99%. And interestingly, it's been a finding of this first year's programme that very, very few of our adult social care providers actually had any understanding at all of antimicrobial resistance. So it's been quite an eye-opener, and we've been able to impart quite a lot of knowledge through this programme. So I hope that's been informative. There are some useful links attached on the end of the slides there. Thank you very much.
Thanks, Mandy. Yeah, and we'll, Mandy, as she said, she's put these useful links in, and we'll share these with you after the session when we can share the slides. Thank you, Mandy. So now over to Martin Cutts, who's an advanced health improvement specialist, who's going to share some of the community engagement initiatives over in his area of work of Leeds. So over to you, Martin.
Thank you, Sarah. So yeah, thank you for inviting me to speak today. As Sarah says, I work for Leeds City Council Public Health Team, part of the Health Protection Team. One of our key priorities is AMR and its links to infection prevention as well. So next slide, please, Sarah. So I thought I'd start by just showing a slide on the latest iteration of the 5-year action plan, the UK government's strategies to reduce AMR, and this was updated in May last year. Obviously, on there, there's a range of themes and associated actions. I want to talk specifically about 2 that are on there, and how, from a public health point of view, we're looking to support public engagement and education, also linking that into with the health inequalities as well. UK HSA research tells us that there's some public awareness around AMR and its global risks. However, most people really, from a public health point of view, don't really know what they can do. There are still lots of misconceptions about antibiotics and incorrect behaviours, particularly in certain cohorts of communities, specifically younger people and diverse communities, particularly in the UK and Leeds. Next slide, please, Sarah. So just to focus on some of those kind of insights around behaviours and misconceptions, we did a project of work in Leeds. We went to some community groups in areas where we suspected potentially there was less health literacy, deprived areas, diverse communities, and this is some of the insights that we got from those events. Just talking to people about AMR and antibiotics. So people. Some people haven't heard of it. There is some understanding that antibiotics kill germs. There's some mistrust of healthcare services. Often, because of the way that the UK health system works, people may have less awareness about what the appropriate routes are. May kind of try and ride out and not visit the doctor unless they feel it's really urgent. Potentially asking friends and family if they've got any medicines, sharing with friends and family, keeping antibiotics back for next time, using antibiotics as a general pain relief, and linking in negative perceptions around things like vaccinations. So the kind of proactive things that are available to try and reduce infections. Next slide, please. So bearing all that in mind, these are some of the things that I wanted to briefly talk about today that we've worked with partners across the system and from a public health point of view taken lead on, try to collaborate with partners and communities to deliver 3 specific things that I want to talk about today. So the Beat It School sessions focusing on antibiotics and infection prevention, some community engagement campaigns, and waste management and how that links in with antibiotic disposal as well. Next slide, please. So I'll briefly talk about the interactive school sessions that have run for a number of years in Leeds. These are funded by the council. They're delivered by our school health and wellbeing service. It's aimed at 7 to 11-year-olds. The sessions focus on infection prevention and how that links in with antibiotics. There's bits on self-care, and there's also information that children take home to engage with their parents as well. The sessions are targeted on the communities that I mentioned previously, deprived areas, higher prescribing areas, diverse communities, and last academic year, it's ongoing this year as well, but last academic year, the service delivered 81 sessions in schools, reaching 3,500 children. I mean, the aim of the sessions really is to have a better understanding about the treatment and prevention of infections, what's appropriate in terms of antibiotic use, awareness raising in schools. It's on the UK National Action Plan. It is a priority. It aims to raise awareness, to build future understanding and support for action on AMR. Obviously presented in an educational setting. Children potentially be able to drive that behaviour change in the future. I spoke about the younger populations earlier. Children obviously they're going to grow up to be the next generation of healthcare professionals, the next scientists, the next patients as well, and also the next policymakers. So it's really important to try and educate the next generation, really. So next slide. Just some photos of some of the sessions there. They're really interactive. There's quizzes and games and things, and the service are fantastic at delivering those sessions. Just from I didn't mention it on the slide, but just from an evaluation point of view, they do a pre and post quiz. It's really positive in terms of the knowledge that's gained, and we can see that from the quiz results, which have a number of questions on knowledge outcomes. Next slide, please. So the second of the 3 points, I wanted to talk a little bit more about engaging with the general public. One of the most recent campaigns that we did in the summer, it had a number of strands to it. We looked at a social media campaign, and it was really well engaged with. It was shared and through lots of our local community organisations, as well as some of the resources and things which I'll come on to on a later slide. But specifically, the events we arranged were part of long-standing what we call Breeze events in Leeds, which target young people, children, families. So really that cohort of people that we want to engage with around increasing that public awareness. 6 events we attended through July and August, supported by Leeds Community Healthcare Trust, one of the NHS providers, Leeds City Council. We also had a number of third sector organisations involved as well. Again, they were focused on the highest prescribing areas, lowest health literacy, evidence from the insight of inappropriate antibiotic use. From an evaluation point of view, over those 6 community events, we had 320 plus conversations with the public. They're the only ones that we recorded. They were really busy. It was difficult to record everything. Part of that, we also had a pledge scheme as well, where we asked people to make pledges about antibiotic usage, and one of those is telling others about the dangers of AMR and appropriate use of antibiotics. Next slide, please, Sarah. On the flip side of those positives, just to highlight some of the inappropriate behaviours, we did have some of these comments that we, from an evaluation point of view, we wanted to kind of record everything. And this is some of the feedback that people gave to us in terms of how they perceive antibiotics. So that there are quotes on there about buying them from abroad, using them if they're sick as a general catch-all, taking them all the time, use them too much, etc. So there is, that just highlights that there is that potential knowledge gap in certain communities, which is through this work we're looking to try and bridge. Next slide, please. These are some of the local resources that we developed. We developed these collaboratively with organisations to ensure that they were clear and they provided the correct information. Part of it there, the know who to turn to, was focused on more of an access to healthcare. So highlighting all the services that are available in Leeds, that people don't necessarily need to go to accident and emergency, or potentially not know where to turn and save antibiotics and just take them as a stopgap. Next slide, please, Sarah. We did have those resources translated into a variety of languages for the events, and at the request of organisations as well. So they're just some of the same resources translated. Next slide. And just some photos of one of the events. So that the stall there, you know, they were really busy events. It was focused on AMR, but we did want to take resources that linked in to all the things that can potentially have an impact. You know, we had resources on hand hygiene, UTIs, sepsis, weather health and things as well. But we did try to talk to everybody, you know, specifically about AMR and antibiotics. Next slide. We also in Leeds have the Seriously Resistant campaign, which is a long-standing campaign aimed at both the public and staff. It's a really good resource to signpost people to, and we use that link to signpost through all our comms really. So yeah, it's got lots of resources on there, and yeah, people that have used it have given really good feedback. So yeah, next slide, please. And finally, I just wanted to talk about the waste management side of things. As Sarah alluded to earlier, we do know that people unfortunately dispose of unused antibiotics in the bin and maybe pour liquids down the sink. You know, we have had people turning up to our waste management sites and asking, you know, how they get rid of medicines and things. So looking at the resources that were available, there was nothing on our literature and websites that provided really useful and accurate information. Nothing had been shared through those channels historically. So we really wanted to action that. So what we can take in terms of waste, that the medication was added specifically on that information, the no thanks as well. And it obviously highlights where people can take that in terms of GPs or pharmacist. The social media, we run that through the campaign, as well as changing the information that's available to the public. It's a massively utilised resource. The waste management site on the council website is one of the most heavily used sites in the council. The Leeds Recycle Facebook has 12,000 subscribers. The Waste Management newsletter has 22,000 subscribers. So it's huge numbers of people that this information is reaching. So and as Sarah said, you know, the effect that antibiotic disposal can have on the environment and other things is a really important priority. So something that we wanted to work on. And then lastly, just some of the other things that we're doing for this week specifically. We have another social media campaign running at the moment. We're also launching a staff training offer this week for voluntary and community organisations to train their staff on the risks of AMR and the appropriate use of antibiotics, so they can talk to their service users. We've shared the toolkits that we have available through lots of different providers and organisations to run their own initiatives. We've got advertisements and communications on media such as the big screen at, in the Millennium Square. Yeah, we've also tried to promote World Antimicrobial Awareness Week with the school sessions as well, and the developing a bit of a competition, a poster competition with certificates and things as part of that work as well. So obviously there's that promotion side of it for the sessions, but also a further engagement opportunity for the the kids and parents there as well. Okay, I think that's everything from my slides. So yeah, thank you very much for listening, and I'll hand back over to Sarah.
Thanks, Martin. That was brilliant. Thank you so much. So I'll pass over now to our final speaker, Kelly Attack. So she's based at one of our largest teaching hospitals in Leeds, and she's going to talk to you about some of the activities they've carried out for World AMR Awareness Week, past and present, I think. So over to you, Kelly.
Thank you, Sarah. Yeah, my name is Kelly Attack. I am the lead pharmacist for antimicrobial stewardship at Leeds Teaching Hospitals. I've got 3 other pharmacists who work in my team across our infectious diseases department and for antimicrobial stewardship, and a specialist pharmacy technician as well. So I'm going to talk about a couple of bits. So one is the Infection Summit, and one is our IV antibiotic review initiative. Next slide, please, Sarah. So we held our first Infection Summit last year, and the purpose of that Infection Summit was to basically bring the organisation together to do an educational event around antimicrobial resistance and antimicrobial stewardship. We got some really brilliant feedback, so we wanted to do it again, and we're hoping that we'll make this a yearly event. So one of my colleagues, Zara Tarek, led on this, so I can't take all the credit, but we had a working group with others involved to set this up. So this year was a much more collaborative effort, so between our antimicrobial stewardship team and the infection prevention team. So this year, our main purpose was to inform teams about the Trust's antimicrobial use, support learning, quality improvement and collaboration to improve stewardship and infection prevention and control. And our main tagline was that we are fighting antimicrobial resistance. So we invited people from all clinical backgrounds across the organisation. So we have a children's hospital here and varying specialties, cancer, cardiology, respiratory, a massive variation, surgery. And we invited people from all, we tried to get a good spread from across the Trust of people attending. And there were 85 people who came this year, and a similar number to last year. Next slide, please. So this is our agenda for this year. So it just gives you a bit of an idea of what we did. So in the morning, we had lots of talks. They were quite short to keep people engaged. And we had the pleasure of having lots of guest speakers. And then in the afternoon, we did some quality improvement discussions. So we got people involved. Everyone sat around tables and discussed their ideas. So we had kind of 2 themes across the day. So one was AMS and one was IPC. So we had a bit of all sorts. So we talked about what our position is in terms of the organisation. So how much antimicrobial resistance we have in the organisation and the impact of that. So we had a really powerful patient story, and one of our IPC lead nurses recorded a video with a patient who was having peritoneal dialysis, but unfortunately became an inpatient, and as an inpatient got a resistant organism. And that meant that that patient, unfortunately, could not have peritoneal dialysis anymore. And she had to have hemodialysis, which means that she has to come to the Trust 3 times a week to have that dialysis rather than being able to do it herself at home. And she talked about the massive impact that that had on her life with her teenage children, that she couldn't go away for weekends away in her caravan, which is far away from here, so couldn't stay overnight and things like that. So had a huge impact on her lifestyle and on her family as well. So that was a really powerful story and had a big impact on the day. And then we also talked about some of our stewardship initiatives, so #cares, which I'll tell you about in a little bit, and other things that we're doing around diagnostics as well. And then we also, which was really nice this year, which we did for the first time, was having some people along who'd done some good project work. already. So we had somebody from paediatric haematology and oncology and what they'd done to improve infection prevention. A dentist who was doing a clinical leadership fellowship in the trust, who'd focused on inappropriate piperacillin tazobactam prescriptions in the elderly medicine team, and one of the neonatal doctors who talked about the reduction of gram-negative bloodstream infections. And then at lunchtime, we had lots of stands from different people, which was really good. So we had stands from our outpatient antimicrobial team. We had stands from the infection prevention team. We got some reps in, so that was really good. So people could go across at lunchtime and talk to different people. And then in the afternoon, we had a really good quality improvement session. So we learned a bit about behaviour change and the behaviour change wheel and things like that, and then talked about what we can do in terms of antimicrobial prescribing and infection prevention and how we can improve those things. Next slide, please. There's some photos there of the day. So the team on the top right-hand side are the team who organised everything. So there's some of my team in there, which is really nice. So yeah, it was everyone was really engaged. Next slide, please. And there's just some feedback here. So it was all very positive, which was great. So 54% of the attendees provided feedback. 72% of people gave the event 5 stars, 5 out of 5, which was very nice. There was only one person who gave 3 out of 5, and the rest gave 4 out of 5. So it was all very positive, which was really good. We collated quite a lot of feedback, but a couple of the main points here were that nearly everybody felt after the event that they had a better understanding of how behaviour change in particular can improve antimicrobial stewardship and reduce antimicrobial resistance. And nearly everyone felt like their knowledge and understanding of AMS and AMR in general had increased. So that's really positive. Next slide, please. So future events, we actually have a follow-up meeting tomorrow, which is the first time that we've done this, because there were so many fantastic ideas from that QI event in the afternoon. We wanted to see whether people had taken any of those ideas forwards. So we did the event on the 1st of July. So people have had a good few months to crack on with bits if they've had the chance. So tomorrow we've got representatives from some of the different clinical services in the organisation who are coming to see us, and they're going to give us some short presentations of some of the improvement work that they've done. And then on the back of that, we thought, well, actually, how do we keep this going? So we've got the LEAP programme, which is organised by the British Society of Antimicrobial Chemotherapy, and we've got some LEAP collaborators who are in the organisation, and we're going to launch an AMS collaborative at LTHT and involve the LEAP collaborators and also some people who've been to the Infection Summit, so that we can try and support them doing some AMS project work in the future and try and have some regular meetings to support some QI work. And then hopefully we would like to do this West Yorkshire wide in the future as well. So we're just looking at how we can do that, but definitely have something again at LTHT if we can't do it across West Yorkshire. Next slide, please. And I just wanted to mention as well, one of our other stewardship initiatives, which we are spending a lot of time during WAAW and also at the summit to talk to people about. So we've got our national guidance from the UK Health Security Agency, which is called Start Smart Then Focus. So this focuses on, basically, it's a toolkit that focuses on prescribing the right antibiotics to begin with, and then making sure that there's a review in place of those antibiotics, so that we're not using broad spectrum antibiotics too much or inappropriately. So in this guidance, there's a couple of statements here. So we should have, as an organisation, evidence where we are documenting the indication and duration or review date of an IV antibiotic on the drug chart or in the notes. And we should also have evidence of an antimicrobial stewardship review being done of those antimicrobials at 48 to 72 hours after they've been started, and that should be documented in the review. And we've always struggled with this, so we've got a new initiative to try and sort this out. Next slide, please. So we essentially have to have data on this, on IV antimicrobial review. And previously, quite a long time ago, this was pharmacist led, and our pharmacists used to go on every single ward once a month and do audits. But it was really hard to engage people to do that because it was seen as quite a boring job and very time consuming on top of everything else that the pharmacy teams had to do. And also, this is not just a pharmacist's job. This is everybody. Everybody should be involved with this, not just us. It should be medics and nurses as well. So we have electronic prescribing here. So we have a clinical review system. So you can set a clinical review for a drug. However, when we implemented the system, we didn't really do anything with the clinical review, and this was one of the only things that it was being used for. So nobody really did it. And now we've developed a digital way of collecting the data. So if somebody, so one of my colleagues, Sarah Hackney, has led on this in our team with the digital team in the trust. And now if we've got a way of basically, if somebody has been prescribed an IV antibiotic, we've got a digital way of the notes being scanned for the words #cares and then #whatever the outcome is. And then we can have a kind of an automated way of collecting that data to see whether the review is being done. But it relies on the clinicians writing #cares and then #whatever the decision is. Next slide, please. So this is our poster. So this is what we're trying to encourage people to do is write #cares when they've done an IV antimicrobial review. And then there's the outcome of that review as well. We'd like them to document that. And this acronym comes from the Start Smart Then Focus guidelines. So we want people to write cease if the antibiotic is going to be stopped. Amend, so you might want to narrow your spectrum. So go from a broad spectrum to a more narrow spectrum based on results. Refer to our outpatient parenteral antibiotic service. Extend, so you might not have all your results back yet, so you might want to continue those antibiotics or switch from IV to the oral route. Next slide, please. So this is some data on #cares. So we're still working on this. So we've got about 13% of people of antibiotics having #cares written in the notes, and it's variable across certain teams. So our elderly medicine team have been fantastic at implementing this. Some of our surgical teams have done really well. But this is something that we are making a key performance indicator in our trust. So all of these departments will be held to account on this shortly. So we're hoping that that will cause the #cares data to shoot up for us, and we can see that all those reviews have been done. Next slide, please. So are these initiatives actually doing anything? Next slide. Yes, which is nice. So there's been a few different things that we've done alongside these things, but we can see actually from, so we essentially had in our national action plan that we had to reduce our baseline antibiotic consumption by 10%, agreed based on a 2017 baseline. We've now gone to look at the 2019 baseline, and we're trying to maintain the previous reduction target of 10%, and we're actually achieving that. So this year we are down 16.5% with our broad spectrum antibiotic consumption, which is amazing because this is the first time that that's happened in a really long time. And it's not just these two initiatives, but there's lots of other work going on. But it's a really good achievement for us. So we're hoping that that will continue. Next slide. I think that might be it. Yeah, thank you very much for listening.
Thanks so much, Kelly. Such a lot of work that we've heard about. But I'm now going to hand over to Solomon and Arnold in Uganda. Over to you, Solomon.
Thank you, Sarah, and thank you, everyone, for that wonderful presentation. Really, there's been a lot that we can learn from as far as AMR is concerned. On our end, there have been a number of partnerships that have supported antimicrobial stewardship, and without much ado, I want to invite Dr. Arnold Bakabweyaka to give quite an overview about AMR in the country, but also in the region, Sub-Saharan Africa, and then look into the work that has been done and share some learnings and some of the areas that we think could be prioritized for partnership. So Arnold, without much ado, I want to hand over to you for your presentation. Over to you, Dr. Arnold.
Yes, thank you very much, Dr. Solomon and Sarah. Without much ado, I'm going to start and basically give an overview of the status of antimicrobial resistance in the country and what the Ministry of Health and different implementing partners are doing in a bid to build capacity for antimicrobial stewardship. Next slide. Yes, this basically provides a brief overview of the burden that we have in country. Notably, we have still a high burden of communicable diseases, contributing about 75% of the disease burden in the country. And from the global burden of the disease study that was done in 2019, we had a very high number of deaths attributable to AMR and those associated with AMR. And surprisingly, these deaths were much higher than the previously documented deaths from diseases like malaria, HIV, TB, and even patients with cancers. The data that was provided that time highlighted 5 organisms that contributed the highest burden to these AMR deaths, and that was Klebsiella, staph, strep, E. coli, and Salmonella typhi. And the infection syndromes that were caused were usually lower respiratory tract infections, bloodstream infections, and intra-abdominal infections. Recent data is also highlighting high resistance levels to escape pathogens like Pseudomonas and Acinetobacter that are causing very high number of hospital-acquired infections. And this data also shows that we have a big burden of AMR in human animal health and within the environment itself. Uganda as a country is enrolled on the global AMR and microbial use surveillance system, where we report periodically. We have 22 sentinel surveillance sites for human health, animal health, and environmental health. And from the data that was submitted in 2023, it shows quite high resistance patterns for gram-negative bacteria organisms to third-generation cephalosporins, though the reserve antibiotics like imipenem are still having low rates of resistance. Next slide. Yes, so Uganda as a country, in line with the global action plan against AMR, developed its first action plan against AMR in 2018, and this was implemented until 2023. We had our second WHO joint external evaluation to see our country's compliance with the international health regulations, and these are some of our milestones from implementation of our first national action plan. Centrally, we had developed structures for leadership at the Ministry of Health with different technical working groups. Guidelines had been developed. We had set up reference laboratories centrally, and others at a subnational level. And some of these laboratories have attained international accreditation from SANAS. Amongst also the campaigns that we're having to improve awareness within the community, we have been having national AMR conferences and have been basically having activities to celebrate World Antimicrobial Awareness Week. Next slide. Some of the limitations that were documented mostly were funding constraints, where we had less than optimal funding. We also had weak coordination of our implementation and dissemination of findings across both sectors of human health and animal health. Our key performance indicators were not properly aligned, and we had issues with feedback of data that was generated from the sentinel surveillance sites to the end users who are the prescribers at the facilities. Next slide. So from Next slide, please. From the experiences from our implementation of our first action plan, Uganda has developed our second action plan, which was released earlier on this year with different interventions and objectives. And I'm going to basically focus on those that are covering antimicrobial stewardship, which involves strengthening antimicrobial stewardship programs both within public health facilities and the private sector, optimizing access, strengthening diagnostic stewardship, promoting rational prescribing, and ensuring quality, safety, and efficacy of antimicrobials and diagnostics. The National Action Plan details different activities under these different interventions, and the Ministry of Health is working with different implementing partners to support these activities, both within the public health setting, at different levels of healthcare, and within the private healthcare setting. And I'm just going to quickly go through some of the activities that are highlighted for the different interventions. Next slide. So beginning with antimicrobial stewardship programs, remember this is a continuation of our previous interventions from our previous action plan. So the Ministry of Health is looking at ensuring that there are functional technical working committees at different, both centrally at the Ministry of Health and the different healthcare facilities. And it has been mandated for hospitals, regional referral hospitals, to all have medical medicines and therapeutics committees, as well as antimicrobial stewardship committees that lead activities in their facilities. As a country, we've updated our antimicrobial stewardship guidelines that was released earlier. These are being delivered to the different health facilities to ensure that they have clear terms of reference and they know what roles they're supposed to do. Next slide. Sarah, next slide. Yes, and via optimizing access and to antimicrobials and diagnostics, part of the activities are monitoring availability and access of essential medicines at health levels. We've had challenges with stockouts, which also have a role in driving antimicrobial resistance. The Ministry of Health is also working with different implementing partners to enhance financing systems to ensure that there is regular stock and improvement of supply chains of different antimicrobials and supplies that are needed. The Ministry of Health is also working to establish systems to restrict use of watch and reserve antibiotics across human health, and also use of antimicrobials in animal health, which is a very big burden in our country. Next slide. Part of the activities that are detailing strengthening antimicrobial stewardship is developing protocols for diagnostic stewardship, training health workers on utilizing an uptake of diagnostic stewardship, that is microbiology essentially, mentoring health workers, basically improving utilization of diagnostic stewardship. One of the big challenges we're having as a country is the way we investigate our patients with regard to blood cultures. So I think the Ministry of Health is working with ways in which the key sentinel surveillance sites and different healthcare facilities can be readily supported with blood culture bottles to avail this challenge. The ministry also wants different stakeholders to come up and support health facilities to do periodic audits of microbiology testing practices, develop clinical decision support tools to ensure that appropriate tests are being done and results are being relayed to patients in a timely manner. And we're working with health facilities that have microbiology labs to support them to develop antibiograms at their facilities. We have the Uganda clinical guidelines that work across different healthcare facilities, but they do not work specifically for tertiary health facilities. So the Ministry of Health is basically supporting these facilities to collect the data and then come up with their own specific facility protocols for managing the different infection syndromes. Next slide. With regard to rational prescribing, the Ministry of Health is working with the national medical stores to see how to enforce regulations on private pharmacies to counter over-the-counter sales of antibiotics, which is also a big problem in our country, where we don't have clear regulations on antibiotics, where we have patients who can basically go to a pharmacy and request for antibiotics without a prescription. We're also updating our guidelines for management of different infection syndromes and putting in note that we haven't had previous guidelines for managing of MDR pathogens in country. We're also having mentorship and supervision activities to improve prescribing and dispensing of by the prescribers in animal health, but also keeping in note that the people in the veterinary section are using a lot of antibiotics. Next slide. And then with regard to quality and safety, the onus is being put on the national medical stores to come up and strengthen national quality control mechanisms to ensure that the antibiotics we have are safe and effective for our population. We are also training retail pharmacies and retail owners on principles of antimicrobial stewardship such that they can make informed dispensing practices, ensuring inclusiveness. We're also monitoring antimicrobial residues across sectors in the environment and in animal health to ensure that there's no contamination and spillover from the animal section or the environment to the population. We are also strengthening detection mechanisms to identify and address substandard and counterfeit antimicrobials. We have had a lax regulatory system where we have different medications coming in, especially antimicrobials from different countries, and we've had reports of adverse drug reactions, poor efficacy. So the national medical stores and the National Drug Authority are working together to come up with ways in which they can combat these substandard drugs. We're also coming up with disseminating guidelines for pharmaceutical and antimicrobial waste management in the country that we previously have not had. Next slide. Yes, so for our current antimicrobial National Action Plan 2024-25 to 28-29, it basically has a short-term phase, medium-term, and then long-term. And the short-term is basically focusing on establishing governance, regulatory mechanisms, improving awareness about AMR and antimicrobial stewardship, and then setting up surveillance structure all throughout the country. For the midterm, we are focusing on expanding these surveillance interventions, enforcing antimicrobial stewardship at all levels of healthcare, and strengthening regulatory oversight. And in the long term, we want to evaluate these interventions, ensure financial sustainability, and integrate AMR programs into national health, agriculture, and environmental systems. Next slide. Now, the different facilities, the public health facilities majorly, have been mandated to support rollout of this action plan. And with regard to antimicrobial stewardship, they're supposed to mirror the different critical aspects. They're supposed to have leadership and commitment structures within their health facilities, which are accountable and responsible, and they should have interventions of education and training, and there should be a reporting mechanism both within the facility and then a reporting mechanism to the structures centrally at the Ministry of Health through the technical working groups. Next slide. The different healthcare facilities, they have been mandated to come up with either antimicrobial stewardship committees or teams, depending on the levels of healthcare. And these are supposed to be multidisciplinary. Like I said, they have now an AMS manual that has clear terms of reference that should enable them lead and AMS activities at their facilities. And these AMS subcommittees basically report to the facility medicines and therapeutics committees, which report periodically to the national AMS subcommittees. So you'll find that at a majority of at basically all of our national and regional referral hospitals, we have these structures in place with ongoing activities and with clear terms of reference as of now. Next slide. The Ministry of Health has come up with an indicator matrix for monitoring antimicrobial stewardship, both at the facility level and at the national level. Beginning at the facility level, facilities are now required to basically report their implementation structures with regard to structural indicators and then output indicators on a periodic basis. That is coming up with teams that are leading antimicrobial stewardship activities and then looking at how they are using antibiotic at their facilities. One of the previous studies that we've done have consistently showed that one of the biggest clinical conditions where antimicrobials are used without justification is upper respiratory tract infections. And across the different levels of healthcare, especially the lower ones, we are targeting them to basically report the percentage of patients who were prescribed antibiotics with upper respiratory tract infections. Next slide. At the national level, so I think the next slide has an indicator matrix for the national level.
You're on mute, Sarah.
Apologies, I think I must have missed a last slide there, Arnold, off the pack. Are you able to talk through your last slide? I'll try and find it.
Yes, that is fine. So at the national level, we have indicator matrices for the laboratory systems, antimicrobial use, and antimicrobial consumption, and then functionality of medicines and therapeutics committees with a baseline and targets, and then a reporting frequency. As of now, I would like to mention that amongst the hospitals, that is hospital level, regional referral hospitals and national referral hospitals, we have about 40% of these hospitals with preliminary antibiograms, and around 40% of these healthcare facilities have conducted at least one environmental swabbing in the last year. Among the different healthcare facilities, we have 26% of the healthcare facilities doing audits through point prevalence surveys, and moving forward, our target is to have 70% of them doing this kind of audits to ensure that they have an insight into how they're utilizing antimicrobials. With regard to setup of structures, we have around 56% of hospitals, regional referral hospitals in the country with functional medicines and therapeutics committees with their various subcommittees, including antimicrobial stewardship. And our target by 2028 would be 90% of all healthcare facilities having these structures in place. Some of the biggest barriers to implementing antimicrobial stewardship, not only in Uganda, but other low, middle income countries, has been a lack of sustainable financial planning for antimicrobial stewardship programs. So the Ministry of Health has previously relied on different implementing partners coming in to support. But as we know that we're now going through a global crisis with financial cuts all over. So the Ministry of Health is looking at owning these different interventions within healthcare facilities and fixing them within the hospital-specific budgets. And we think that this at least will improve the financing structures for the different activities in the healthcare facilities. With regard to limited diagnostic capacity, the Ministry of Health is working to set up all regional referral hospitals and hospitals with capacity to do microbiology on site. And for the lower healthcare facilities, they're going to work within the networks of care through a hub and spoke system to refer these samples for microbiological testing. The Ministry of Health is also working to digitalize tools. We are now we've moved on to an electronic medical system, and it's a requirement for all healthcare facilities to have electronic medical records, and we think that this is going to improve on how we gather data from these different healthcare facilities and be able to feed back to them. And I'm going to summarize by mentioning what is going on during this week in Antimicrobial Awareness Week. We have our 10th Antimicrobial Resistance Conference that is running from 19th to 21st in Kampala. We usually have it going on One Health approach. So we have different thematic areas and presentations come up utilizing work, and they will be sharing these successes. We also have awareness campaigns that are being organized by the Uganda National Institute of Public Health and partners, which include events, webinars, public outreach programs. And then from the community health engagement perspective, we have awareness walks that are being organized across different districts. We have social media hashtags that are being driven to basically ensure that the right information is reaching different people across different sectors. For facility-specific interventions, we have implementing partners who are working in different healthcare facilities who are supporting AMR and AMS sessions, hand hygiene campaigns across the country. And I would want to stop with that. I hope you will get more information from the slides that are shared at the end of this webinar. Thank you very much. Over to you, Sarah.
Thank you so much. I do apologise that I'd missed those last few slides off and they hadn't come through. I'll look back on it and make sure that everybody has a chance to look at those properly after the meeting. We could share them. So I guess we'll stop there because I suppose this is where our conversation starts together. So if we're going to build a global partnership between West Yorkshire and Uganda, we'd really like to hear about what you think, what stood out for you today. Where do you see some of those real opportunities for us to work together? What might get in the way? I think we've heard a few of those today in terms of the funding and some of those issues that we all feel. But yeah, I think there are things that we need to, things that we could work on to tackle together as we go. So please feel free to jump in with any questions or thoughts for the speakers. But yeah, it'd be really nice to just shape some of those next steps with you while we're together. I don't know if there was any questions in the chat. I couldn't see that going on.
Yeah, there was actually. Thank you. I think it's probably for Arnold. And it's Muzamil's asking. I was wondering if that has a track and trace system. Has it been explored, e.g., using QR codes as a way to strengthen medicine quality and safety? Is that something you're aware of, Arnold, or anyone else?
Yeah. If I could answer that, yes, please. So our import mechanism of drugs, they have to go through the National Drug Authority, have this medication tested, and they get a stamp or with a QR code from the NDA. So we have this ongoing. However, we have loopholes in the system that we do acknowledge, and but these are being tackled as we speak. Thank you.
Yeah, thank you.
Over to you, Sarah.
There's no further questions, but I think obviously just wanted to say as well, thank you everyone who's here today, because it's the start of kind of a conversation around AMR and building upon the other work we've done in our partnership with Uganda and West Yorkshire. So based off kind of similar work we've done around maternal neonatal care, we host virtual events every couple of months. That's one thing we might look to build towards, potentially coming back again in 2 or 3 months and exploring another sort of angle to AMR and our work in this area. And you know, through practicing the kind of virtual collaboration, that may lead to other things as well, projects, coordinating on bidding for grants, etc., etc. But just quite very keen to hear people's thoughts, and thank you again for being here at the start of this collaboration.
Thanks,
Sarah.
yeah, I just had a quick question actually. We heard there about that people are able to go to your private suppliers and ask for antibiotics, and I just wondered whether you're able to capture what people are asking, requesting antibiotics that, you know, unprescribed. Why are they requesting antibiotics, and also are you how your campaigns look in the community in terms of public awareness around AMR and what that looks like in Uganda, if people are able to go and access antibiotics themselves. Perhaps to Arnold, I suppose, or Solomon, or any other colleagues on the call.
Yes, thank you, Sarah. So it's important to note that unlike in the UK, we have not previously had a very good regulatory mechanism for how we access antimicrobials. The interventions that have been driven previously to tackle awareness within healthcare facilities have been driven in the public healthcare setting, though we have different implementing partners that have reached out to private healthcare facilities, private pharmacies as such. So we do not have, we haven't had a mechanism where we are able to capture, let me say, sales or stocks within private pharmacies.
Yeah.
But I think recently there was a discussion from the National Pharmaceutical Department, and they're tabling some documents in which they're going to have such controls in place. I don't know whether that completely answers your question.
Yeah, no, I'm just really interested to know what people understand around antibiotics as well. I know that that's something that it's been a challenge for us in the sense that people understanding what an antibiotic even is or what it's used for, when people are sharing them or buying them themselves, although that can't legally happen in this country, we know that it does. So it's just what we can learn really. Does anything, and also, you know, just share some insights together on that. But yeah, thank you, that does answer.
Yes, in addition to that, there are awareness campaigns that are trying to reach a vast majority of the community through radio talk shows and television programs. And then at the healthcare facility, we have interventions where we do health education for patients whenever they come to the health facility. So antimicrobial resistance and stewardship is being incorporated into these health education talks on a daily, such that patients know how they should effectively and rationally use antimicrobials. We also have community health extension workers. These are people with very basic training, not particularly medical, but they are trained to be able to provide services to the community on the lower levels. That means they can reach the patients at their homes. So previously they've been providing things like reproductive healthcare education, providing insecticide treatments for malaria. But these key persons who reach the community at the grassroots are now being empowered to provide education about antimicrobials to the people. So we hope that with time, we're going to have the populace being knowledgeable about antimicrobial resistance and stewardship.
Fantastic, thank you. Thank you. Thanks very much. I don't see if there's any other questions in the chat.
Yeah, none of those in the chat at the moment.
I don't think so.
Yeah.
Okay. Are there any other questions for any of our speakers, from colleagues, or perhaps one to think about? in terms of where we go next and our next steps.
Yeah, and to help
Okay.
with that, in the chat I've posted a link, which is a feedback survey really, which would be just good to hear how people have found today's session and contribute any ideas that we could, like as I mentioned, cover on future sessions we might wish to run. So we're really grateful if you could take a moment or two to complete that. Thanks. We can email it afterwards as well to everyone who's attended.
I'll make sure the slides are caught up with that as well. And whether or not we want to take a more of that traditional grand rounds approach in the future, with some presenting some clinical cases that we've seen in some of our trusts and what that might look like in what area, what specialities, just having to think about some of the things that colleagues have shared today. So yeah, thank you so much for your time, everybody.